Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, the honorable judges, and distinguished audience. On this remarkable occasion, we are all here to discuss a topic related to healthcare and technology. But before we dig down into the material, I would like to share with you a brief personal story, and I'm confident that you might have heard or seen this information before. So it was started a few weeks ago when I was lying down on my bed and scrolling through my Instagram. I came across one interesting page which mentioned that our country, Indonesia, has recently been successful in conducting the first ever remote surgery or distance surgery in Southeast Asia. Dear audience, imagine there are two operating rooms 1,200 kilometers apart, where the doctors were in Bali and the patient was in Jakarta, connected in real time and successfully treating the patient with a kidney disease condition. This is not just a science fiction. This is our reality today. Ladies and gentlemen, I'm Khoirotun Nisa from Universitas Nuur, and I'm standing here with you to take you on a journey with me as we imagine the future of healthcare within the topic of a new normal of technology for advanced medical healthcare innovation. Dear ladies and gentlemen, there are several reasons of why is it essential for us to keep involved in innovating advanced medical healthcare combined with technology. Here are the examples. The first, digital technology enabled us to elaborate any healthcare solutions. This is not a new concept that came in the last few years because of the COVID pandemic. Far from that, people have been talking about digital healthcare and technology for years. But what COVID did was really challenge our system to the core to adapt and stay connected. But in that hopeless situation, we saw the light of people coming together, working together, and bringing together the power of possible by staying connected to the digital solutions. We broke down the barriers of time and space and successfully discovered multiple vaccines in the shortest period that finally set us free from the pandemic. Number two, the principles of medical service must be prioritized on speed, efficiency, and accuracy. Using technology in healthcare improves patient care delivery. High investment in medical devices and robotic systems like CT scans and MRI machines are best to early detect diseases such as cancers, tumors, and internal bleeding. The efficiency of early detection will help patients to get a better treatment results and higher survival rates. Number three, technology is not only effective in breaking down the barriers of time and space, but it's also effective in accelerating patient recovery. Ladies and gentlemen, have you ever heard about the gamma knife surgery at Dr. Cipta Mangunkusumo Hospital in Jakarta? So you never heard about it? Okay, let me tell you about that gamma knife surgery. So basically, gamma knife surgery is a non-invasive procedure that treats neurological disorders and head tumors using gamma rays. This method is highly precise with a minimal risk of error, as it requires exactly 192 gamma ray shots to the targeted area in a single point. By these procedures, patient can recover more quickly because this kind of surgery does not involve any cuts or incision. Dear ladies and gentlemen, we have talked about the essential of digital technology for healthcare innovation. And after we realize the benefits of integrating technology and healthcare in the medical field, let me ask you a single question. The question is, how do we transform our visions of future healthcare service into reality? Alright, instead of keeping you in a suspense, I am excited to share how we are advancing from traditional healthcare practices to digital healthcare solutions. The first is by transforming healthcare into a digital system using smart hospital technology. This is a big step forward in improving patient care and optimizing the hospital operations. We can take some examples such as EHR or electronic healthcare record system that turns patient information to digital files, making them easier to access anywhere. The other example, we got Internet of Things or IoT devices like smart beds and wearable fitness trackers to help monitor patients' health in real time. Then there's also telemedicine that allows doctors to see patients from anywhere through any devices, making healthcare easier to access and reduce waiting times. The second, design and create the healthcare around the patient, not healthcare around the infrastructure. Dear audience, do you still remember the situation during the pandemic when healthcare was very limited? Mobility was restricted and accessing healthcare was very difficult. However, a few years later, in a world driven by technology, patients no longer needed to come into the hospital to have their blood sugar checked or their cardiac ECGs monitored or for any other procedures. We were able to deploy remote monitoring tools such as Apple Watches and any other digital monitoring system that provided us with the real-time information, helping doctors to stay better informed and manage patients while keeping them remote at home. The third is by utilizing technology to improve and accelerate the skills of doctors and nurses in Indonesia. For example, the successful remote surgery between Dr. Cipto Mangunkusumo Hospital in Jakarta and Nuur Hospital in Bali has presented a significant opportunity for our country to continue developing innovations in the healthcare sector. I would like to introduce you to a very useful platform called Proximi. So basically, Proximi is a centralized platform designed to scale expertise beyond the four walls of an operating room. So by using this kind of platform, a doctor could be using their phone, tablet, or computer and virtually transform themselves into any operating room, cath lab, or procedure room anywhere in the world. Doctors and nurses can learn from experts by live streaming and virtual reality or VR technology, or they can share their best practices. So it will be great for doctors and nurses to accelerate their skills and improve global healthcare quality. Dear ladies and gentlemen, to wrap things up, integrating healthcare and digital technology will help us to elaborate any solution in the medical field. So let us continue developing healthcare practices in this world driven by technology. Together, we can break down the barriers of time and space to prioritize the best prevention, action, diagnostic, and treatment for patients. Let us also keep in our mind, because no matter how advanced technology becomes, it will never replace the role of doctors and nurses. Because the essential art of healing is always need the affection, devotion, and sympathy of human heart. Thank you everyone. Wassalamualaikum warahmatullahi wabarakatuh.